So thank you for everyone here who is watching at a remote site or participating in the room here today. Your commitment to fostering engagement at UCSF is essential if we're going to maintain our excellence. Now, when we last gathered, I thanked you for setting the time apart to participate in the survey that Nancy referred to, and the first of our town halls, and I encouraged you all, as many of you have, to participate in the Gallup-led focus groups. Your voices have certainly been heard through all of those mechanisms. And we're here today to share progress on our organizational-wide planning. Your collective feedback has directed us to focus our efforts on fostering inclusivity at UCSF as our highest goal for this year. I say for this year, but I think we all know that this is not a quick fix, and the magnitude of this goal is not lost, certainly on me. We are as committed to eliminating the disparities and levels of engagement between staff as we are committed to our organizational priorities of eliminating the disparities that present healthcare equity for all of our patients. So today, I hope you will leave this session with a clear understanding of our commitment, and that you will also leave with an understanding of our plans to keep you updated on the many additional things that will follow as action steps evolve. We know that to truly create a more inclusive environment, it must be embraced by myself and my leadership team, as well as leadership and management at every level in the organization, and modeled every single day in the actions that we take. As Nancy said in a few minutes, Dr. Talmadge King, the Dean of the School of Medicine, will share what is happening in the School of Medicine, which has yielded higher engagement scores than the rest of the organization. We are here to learn from him and his team and determine if there are best practices that we can adopt throughout the rest of the organization. So I invite each and every one of you to embrace your role as a leader and discover today how you can support our organization-wide action plan and enhance your own personal toolbox to more effectively model and foster inclusivity. So in closing, I'd just like to thank you for your participation. The fact that you're in this room suggests that you know how important engaged in is, and I truly, truly appreciate your leadership and commitment. Thank you. And now, my partner and the CEO and president of the UCSF Health System will say a few words.
Thank you. Thank you, Sam. One of the great things about being part of the UCSF community is our aspirations. This is a place that is exceeding performance on so many metrics, whether it's our research portfolio, whether it's the education work that we do, whether it's our service to the community, the patient care that we do, across a huge, huge area. This week, as I often do on Monday morning, I did new employee orientation for UCSF Health employees, and we talk about our vision to be the best provider of health care, the best place to work, and have the best environment for teaching and research. And we spent quite a bit of time talking about that middle one, to be the best place to work, because what makes an organization great, what allows it to achieve the ultimate, is if the people inside that organization are engaged. It's great to have wonderful facilities like these facilities here, but there are many organizations that have wonderful facilities, but they're not great performers. And it's nice to have wonderful equipment, and there are many places that have great equipment, but they're not great performers. What makes an organization great is its people, and the people who come to work every day and the degree to which they're truly engaged in the work that needs to be done. We also, in new employee orientation, and I think all of you are aware of our values at UCSF, and they're in that word pride: professionalism, respect, integrity, diversity, and excellence. And as Chancellor Hawgood mentioned, as we're talking about inclusion, and particularly related to the results of the survey, the Gallup survey, that indicated that we have disparities in how engaged our employees are by race and ethnicity, by union membership, by other metrics that we can look at. it just highlights the importance, in my mind, of thinking about that D, that diversity. And I always think of diversity, the D, and pride, meaning diversity and inclusion and equity. Because the highest calling we have is to make sure that every person who comes in contact with us gets treated well, is included, and that we're providing service to all in our community and elevating the quality of care for everyone, not just those who have insurance or those who are privileged in some other way. Nancy, I know, will put on a great program today, as she always does. But one of the things I've learned from Nancy, and I hope I'm not stealing one of your slides, but you showed it yesterday, and it stuck with me. It's a finger, and it says one thing. What's one thing that you are personally going to do to make a change? And I will tell you that one thing that I have committed to do, that on March 8th, I am taking my entire management team, and we are participating in the diversity inclusion program that was developed by the School of Medicine. And I want to make sure that we all have the level of consciousness and awareness of the issues that are contributing to some of the issues that were highlighted in the survey. So that'll be the next one thing, but after that I'll have another one thing, because I know Nancy's going to hold me accountable to it. So I thank you all for taking the time to be part of our community, to participate in the work today. We're doing something really important, and it's not just for business reasons or not just to achieve our higher aspirations, but really because it's the right thing to do. And if anyone is going to stand up and do the right thing and demonstrate through leadership what the right thing is in our community, I think it's UCSF. So it's our responsibility, but it's also our privilege to take it on. So thanks for being here today, and turn it back to Nancy. Thank you.